Truth Unveiled here, and today we have a lot to go over. We're going to be talking more about the technological aspects of the COVID vaccine and also the technology that you might not have known that has been going on recently all over the world. We're also going to be sharing more documentation with you, going in depth with the documentation. And later on in the video, I also will be sharing some footage and also some clips with you so you can see what time it really is. But before we go over any of that, I wanted to share this with you in case you did not already know, because this is just one of the many ingredients that they're planning and looking to put in the COVID vaccine. Because this report from USA Today says horseshoe crabs have a vital role in the development of a COVID vaccine. Here's why. And of course, they're going to tell you that, oh, it's good for you, and oh, this is a wonderful thing for humans, and this is powerful for them to defend their immune system when your immune system can defend itself without the use of a horseshoe crab. This is one of the many ingredients that they're looking to put in that vaccine. So before you take the vaccine, just know what you're putting into it and that it could contain horseshoe crab. But I just wanted to put that out there for your reference and also for your research. But now we're going to go over a clip with you to show you what's been going on in the UK and leading up to a cashless society that features biometric technology.
Introducing the weekly shop of the future. Forget the dinosaur days of using your card or, heaven forbid, cash, but welcome to a world where you can pay via the veins in your fingers. Sounds like a spooky sci-fi film, I know, but today this shop became the first supermarket on the planet to use the new technology. So after a quick spree, I'm giving it a go. Here's the science bit. Using infrared, the machine scans the veins in my fingers. The computer then links this unique biometric map to my bank details. There you have it. That's an exciting look into my world. My shopping for the week tick. Now I'm hoping to pay using just the tip of my finger. Hopefully it's all going to run smoothly. Hello, how are you doing? Thank you. Thank you very much. Bye. And look at me go. The tech-savvy among you may already be familiar with fingerprint ID, but experts say this new method is different because it scans the unique layout of your veins, which is virtually impossible to fake. The company behind it say it will be available in shops and bars across the country by next year.
What we've found is there's a lot of hassle using a card. You lose the card, you have to remember a PIN, if you have your phone, it has to be charged. We're just making it as convenient as possible to pay for something.
So how did we get here? The first official coin currency was minted in 600 BC. Fast forward 2,000 years later to the arrival of paper money and cheques. Paper turned to card in the 20th century, with the first credit card issued in the UK in 1966. Cut to 2007 when contactless came along. And in 2014 we saw the first mobile payment.
They're making you forget that you're spending money. So off you go in a carefree way. Might as well have a coffee. Oh, and muffin's nice as well.
Of course, no amount of technology can come in the way of the first rule of retail. The customer is always right. Did it feel a bit creepy that somebody somewhere has got a map of your veins? Somebody somewhere has got a map of your veins? Somebody somewhere has got a map of your veins? Or you call it
Not really. I think this finger pay thing is much more safer than actually using a card, to be honest. And it's less hassle because I don't really have to look into my bag and look for my card.
It feels really safe.
Okay.
You know, nobody can take my finger.
The good news, the process of paying speedy. The bad news, dangerous if you're a fan of impulse buys. Minnie Stevenson, 5 News.
Now, of course, they're going to brainwash the people into thinking that, yeah, this is a great thing. It's perfect for convenience. It's perfect for you and your family. But really, what is the bigger agenda with this? The bigger agenda is, of course, control, controlling your every move, tracking your every move indeed. But now we're going to talk more about the technology when it comes to COVID and the vaccine and why you need to be aware of it and why you need to be alert of these things in case you don't don't already know about them. And there have been doctors that have been speaking out about this as well, but we're going to go more in depth in this because here we are at a report from the FDA themselves that talks about this right here, which is an enzyme called luciferase. Now, when you look at the first 7 letters of that, some alarm bells should be ringing, because is that one of the things that they're planning to put in the COVID vaccine? Because it says right here, luciferase immunoprecipitation system, or LIPS assay, is a rapid, simple, and sensitive test to detect antibody response to respiratory syncytial virus. It says here, researchers at the US FDA have developed a simple, rapid, and sensitive test that identifies individuals who have made antibodies against RSV, the most common cause of serious lower respiratory tract infection in infants and young children worldwide, according to them. They say that it also affects many elderly individuals, especially those with underlying heart or lung disease, accounting for nearly as many hospitalizations as influenza. The development of this new assay is important because they say it could be a valuable tool for assessing the efficacy of RSV vaccines during clinical trials, since it can help to identify individuals infected following a winter season. Wow, what perfect timing, because here we are about to enter the winter season, and here we go with all the COVID testing and the COVID vaccines. What perfect timing. But then it says, since many of the current candidate vaccines contain or express only one or a few of the proteins found in the virus, antibody responses to non-vaccine RSV antigens can serve as a marker of exposure and infection in subjects given these vaccines. Now, what these scientists are claiming about luciferase is that, oh, it's going to be less complicated, it's going to be easier to perform, and then it goes on to say right here that to develop it, it says the FDA scientists, genetically engineer the RSVG proteins from both subgroups. They then tag each G protein with luciferase, which is an enzyme interacting with the protein called luciferin to release light, because that word means light. Then it goes on to say that the luciferase tag G proteins acted as bait to antibodies against the G proteins in samples of human serum, causing them to bind to the tagged proteins. The scientists then added special protein beads that bind the antibodies with the luciferase tagged G proteins to the bottom of a plastic test wall. They then added the luciferin and measured the amount of light released when it interacted with luciferase, which enabled them to calculate how strong the antibody response was to the G proteins. Basically, what this is saying is that these genetically engineered proteins from the assay have the ability to do certain things to your body. Of course, they're not going to tell you right here what it's going to do, but they're going to tell you that, oh, it's beneficial. But is something genetically engineered really beneficial to your body? Because could it have the potential to change or alter your DNA? That's the question you need to be thinking about, as well as when it comes to this upcoming COVID vaccine as well. Because now here we are from a report from MIT that talks about lipid-coated micro and nanoparticles as a biomimetic vaccine delivery platform. Now, I know we're going over a whole lot right now, but the reason I'm going over this stuff, folks, is because it's very important that you are knowledgeable about what's going into your body potentially, or what is actually the case when it comes to this vaccine in particular. And again, folks, you can research and look up different doctors who have said the same thing about the COVID vaccine, how the COVID vaccine is much different than all the other vaccines. And the number one thing that makes it different is the technology, is the biometrics and the nanoparticles as well. Why is that so important? You're going to find out in just a moment to come. Now, we're not going to go over all of this. The reports are linked in the description box below in case you would like to read them. This again is from MIT, or the Massachusetts Institute of Technology, from the Department of Materials Science and Engineering. So this is not some mumbo jumbo that we're making up. This is actual based research. But it says here, biomaterials provide a unique opportunity, listen to this, to control the display, release, and in vivo trafficking of vaccine components. We have designed and characterized a system for vaccine delivery that uses, quote, lipid surfactants approach to combine a degradable polymer core with a 2D fluid lipid bilayer shell. Now, again, I know a lot of this is very sciencey and a lot of technical terms, so we're not going to go over all of it once again. If you would like to, and if this is interesting, you can definitely take a look at it on your own time for more on that. But it goes on to say right here, single tightly opposed bilayers could be formed around either microparticles or nanoparticles, mimicking bacteria or viruses in size. So basically, these nanoparticles that they could be inserting into your body via the COVID vaccine as well, they can do what? Mimic the bacteria or the viruses into your body, but they can also attach to your body as well. The nanochip that could be placed into your body could be a biometric and can be turned on and off at any time. They can also use it to scan your body at any time. It's almost like your body is a credit card now, and they can track you wherever you go. They can track when you sleep. They can track what you eat. They can track pretty much everything about you, because if you take that and put that nanoparticle into your body, there's no way that you can get it out either. And that's the most important part of this, is that this type of technology is so advanced with the COVID vaccine, you're not going to be able to undo it once it is already done. And it is very important that you understand that now. Because think about it like this: if you have a nanochip inserted into your body that the government can use to track and can use to monitor you, well, then not only that, they can use it for other sinister purposes as well. Because if you are a threat to them, according to them, then they can just turn off the chip that's inside of you. And then guess what? They can basically kill you on the spot. I'm telling you this so that you are aware of this ahead of time, and so that you will not take the vaccine, and so that your body will be protected from all of the harmful effects. The mainstream are going to be lying to you and telling you that, oh, the vaccine is a good thing, the vaccine has benefits, and oh, we feel great afterwards. That's what they're going to lie and tell you. But the reality is there are going to be adverse, severe consequences for this one, because it's going to be DNA altering. They're trying to control your body as if you are a robot. They're trying to make a robot out of you, literally, with mind control. That's why they've injected all of this 5G all over the place. That's why you see it all over when it comes to street lights and when it comes to cell towers. Why do they have it everywhere? Because it has to do with mind control. They're trying to control your mind any way, shape, or form, and they're going to be trying to use this vaccine as a way to track and monitor where you go, and literally to be able to see everything that you're doing and have control over your body. And folks, there's already a system for all of this that's taking place, because here we are at another patent. Now, I've gone over this briefly in a video before, but we didn't really go over it too much into detail, but this time we're going to go over a little bit more. It's called cryptocurrency system using body activity data. Now, some people might think that, oh, well, that's a good thing with cryptocurrency, and oh, that's where currency is going. It's going to crypto. But is that the real case? Or once again, is there a sinister agenda with this luciferase? Is there a sinister agenda with these nanoparticles? That's a question that you really need to think about and really do more research on if you already have not. I've enlarged it so you can see it a little bit better. It is linked in the description box below for your reference. Now, the interesting part is how it has the publication number right here, 060606 or 666. Very interesting and suspicious indeed. What is this really leading up to? And how it's also interesting that it was filed around the summer of 2019. Wow, how convenient, right before COVID started to hit. Not only that, but who were one of the applicants? Microsoft. Wow, Bill Gates. Very interesting and suspicious indeed, especially when I share with you Bill Gates' plan and what was written on Bill Gates' blog, and how it actually eerily matches an article that was recently published today, actually. But it goes on to say right here in the abstract that the human body activity associated with the task provided to a user may be used in a mining process of a cryptocurrency system. A server may provide a task to a device of a user which is communicatively coupled to the server. A sensor communicatively coupled to or comprised in the device of the user may sense body activity of the user. So did you hear that? So with this type of technology that they're trying to implement, folks, they can sense even your body activity. They can sense even when you move your left arm or when you move your right arm. They can sense when you're going to the bathroom. They can sense when you're stretching or doing exercise, and they'll be able to track the exact moment in time that you're doing these things. They can track when you're sleeping. They can track when you wake up. Why would they need to track it, you might be wondering? So that they can not only control you, but help when it comes to what you're going to buy at the store next, what you're going to buy at the store tomorrow. If you tell your significant other or your children or whomever, or even if you're just talking to yourself out loud that, hey, I'm running low on this. I need to get this product or this item from the store. Well, guess what? Soon enough, you're going to see an advertisement for that exact product that you just said. In fact, they're already doing that, folks. But then it goes on to say body activity data may be generated based on the sensed body activity of the user. The cryptocurrency system then communicatively coupled to the device of the user may verify if the body activity data satisfies one or more conditions that were placed by the cryptocurrency system and award cryptocurrency to the user whose body activity data is verified. And you can see the little picture right here, how they have the person, the sensor, the user device, communication network, and the cryptocurrency system all in place. What's the problem with this? More control, depopulation. Again, they're trying to track, monitor you wherever you go, and they're trying to use it through this vaccine. Could that explain why Bill Gates wants 7 billion plus people vaccinated, as you're about to see later on in the video, without your consent, without your permission? Why is that the case? Now, again, the government and the mainstream, they're going to keep lying to you, and they're going to keep claiming that, oh, the vaccines do not contain any type of biometric data. It will not be storing any of your information. It doesn't have that type of technology. Well, we're about to see about that, because now here we are at a report from the Rapid USA, or the Rapid Aseptic Packaging of Injectable Drugs, providing rapid population scale packaging of vaccines and therapeutics in pre-filled syringes with real-time reporting of all injections. Now, we've gone over this report as well. It's about 17 pages long. We went over it in our NBA video that was done a few months ago. But once again, I want to look back at this report, because this report will even show you and prove to you how they're looking to also implement biometrics with this vaccine attached to it. Now, again, we've already gone over this document before. If you would like to take a look at it on your own time and read it fully, you definitely can, as it is linked in the description box below. But I'm going to be scrolling down because, again, notice how they even say right here to defend against this and similar threats, because there's always a threat. Your government, aka the HHS and the national defense community, have devoted substantial resources, which of course are these vaccines that they have for everyone. But if you keep going on to the next page, this is the part that I really wanted you to pay attention to. It's interesting how the US wants to acquire 660 plus million syringes. There's that 66 or 666 reference again. But here's the part that I really wanted you to pay attention to, as we've gone over before, where it says right here, remote real-time tracking of injections in the field can be achieved by affixing an NFC or near-field communication tag to each BFS pre-filled syringe. And by the way, BFS stands for blow, fill, seal, the plastic. Then it goes on to say the NFC or near field communication tag will hold a unique encrypted serial number. Some alarm bells should be ringing when you listen to serial number, because they're able to now track who is going to take the vaccine and who does not. Then it says just prior to injection, the health worker would tap the NFC tag to the back of their smartphone, just like using Apple Pay at a checkout counter. A free mobile app would capture and automatically upload the dose's serial number, as well as append patient anonymous data, including time, date, and GPS location, to the government's designated cloud database. Why in the world would they need to do that? Why do they need to track who's getting vaccinated and who's not? And right after they get vaccinated, according to this, they're going to be sending that information information directly to the government the moment that person gets vaccinated. Do you see an agenda with that? Why didn't they do that with all the other vaccines? Why this one particularly? Very interesting and suspicious indeed. Because then it goes on to say they claim that the data is going to be then aggregated and analyzed to provide real-time coverage maps for more efficient vaccination campaigns. Is that really the case, or is there a deeper agenda involved? So again, folks, like we told you before, they already have this laid out. They already have it planned ahead of time. Now it's only time for execution, because here we are at page 8 of this document, as we've gone over before, where it says what they call a severe pandemic, because is it even really a pandemic, or is it a staged plandemic hoax? We'll need single-use plastic disposable syringes for at least 660 million injections, and this is talking about the USA specifically. But then what happens when you jump down to page 13 of the document? Then you get this where it says here, preparedness for pandemics. BFS, or blow-fill-seal pre-filled syringes, enable real-time remote tracking of injections nationwide with low-cost, mobile-ready RFID. So not only do they have the RFID technology for the actual syringes themselves, but they also have the nanoparticles and the luciferase that could potentially be in the vaccine that can track your every move, and that will be DNA altering, and that can control your body, and that can be used to track and monitor wherever you go, and it cannot be removed. Some alarm bells once again should be ringing, because then it goes on to say effective pandemic defense requires officials to accurately monitor in real time how rapidly thousands of clinics are vaccinating local populations, including how many people are being vaccinated and where. Again, the question you need to be thinking about, why does the government need to know that so badly? They didn't need to know it so badly when it came to polio or MMR or the flu shot or all them other ones. So why this one specifically? And of course, they're going to say, oh, because of convenience, and oh, because it's to keep you safe and protected. Is that really the case? Then it says, ideally, health officials would have real-time, continually updated coverage maps and reports based on data steadily flowing in from across the nation, showing when and where each injection takes place. They would see where broad and effective coverage is happening and where and when coverage is lagging. Patterns that would enable officials to better manage their vaccination campaigns, coordinate supplies, etc. And folks, as far as I'm concerned, to also track and monitor how fast folk are dying too. Because the vaccine's going to do the opposite of what they're telling you it's going to do. Operation Depopulation, depopulating the plain to 500 million Georgia Guidestones. Then it goes on to say, all this can be accomplished efficiently and economically by having Rapid USA manufacture each BFS pre-filled syringe with the low-cost near-field communication tag, as you can see right here, that is on the syringe label right there. Now, before each injection, healthcare workers tap their smartphone to the NFC tag using a free mobile app. Their phone captures the unique serial number from the tag, appends the date, time, and GPS location, uploads the metrics to the cloud database, as we've talked about as well, then used to generate useful reports. And they're going to claim it's anonymous, but they already have everything about you. They know who you are, they know your name, they know your address, they know where you stay, they know what stores you go to. They pretty much know everything about you. But the question is, do you? And because they're planning to do this in 2 rounds of vaccinations, they say right here that other features can include compliance reminders to people that it is time to get their second dose, and record keeping that makes sure the patient receives the same adjuvant across both injections. But now we're on page 14 that talks about the overview of the dose level and the point of care and tracking the technology, which is the part I actually wanted to go over right here, because it says right here, number 1, serialization and aggregation. Each NFC tag has a unique encrypted serial number. Tags are attached to each pre-filled syringe during manufacturing. 2, smartphone NFC reading. At the point of care, a nurse taps the NFC tag on the pre-filled syringe to the back of their smartphone before injecting the vaccine. This captures the unique serial number. Again, serial number. What is that telling you? Just like the video you saw earlier of what? Controlling the masses, serial number, knowing your every move and tracking your every move through this nefarious technology. Number 3 says append and send. The smartphone appends additional information to the tag reading, such as GPS, date, time, and health worker. No patient info is recorded. Oh, that can be further from the truth. You want to know why? Because it's going right to the government's designated database. Data collection. Injection data is sent to the database chosen by the healthcare payer. The database can also return drug information to the mobile app, verifying drug authenticity. Of course, they're going to tell you and they're going to keep lying to the sleeping public that, oh, this is a good thing because the benefits of it is real-time injection reports. We'll get to know when everyone is vaccinated and then compliance notifications, and it'll help us update on the second dose and also validated recipients and second dose adjuvant verification. They're going to keep convincing the sleeping public that this is a good thing and that this is for their benefit, but is it really? Now, I found this report to be very interesting because it came out actually today where it says Moderna COVID vaccine shows nearly 95% protection. So, again, they're literally telling you their plans ahead of time. And you're going to see what I'm talking about because it goes on right here where it says a new vaccine that protects against COVID-19. That's what they claim it does. But is that really the case, or is it the exact opposite? Because we know that they're what? Lying to the public about vaccines and their safety and the ingredients in them, because one of the ingredients could be horseshoe crab. Then it says is nearly 95% effective. Early data from US company Moderna shows. The results come hot on the heels of similar results from Pfizer and add to growing confidence that vaccines, according to them, can help end the pandemic, even though there was no pandemic to begin with. Both companies used a highly innovative and experimental approach to designing their vaccines, and they're claiming that it could be used within the next few weeks. Wow, what perfect timing indeed. But here's the part I wanted to bring your attention to where it says that it's 95% effective, because I just found it interesting that you also see that someplace else. Where do you see it? Right here from Bill Gates at Bill Gates' personal blog website. And mind you, this was written well over 6 months ago. But why am I sharing this with you right now? Because as you read right here, it says right here in the second paragraph that we need a miracle treatment that was at least 95% effective to stop the outbreak. Do you think that's a surprise or a coincidence that Bill Gates wrote about that 6 months ago about a vaccine that's 95% effective? And then that article just came out recently from the BBC. Very interesting and suspicious indeed. It's almost as though the whole thing was planned and staged ahead of time. Because then it goes on to say right here that Bill Gates' answer to combat the coronavirus is to do what? That when the way to combat it is when almost every person on the plane has been vaccinated against it. Wow, you know how many people there are according to them? How many people are they trying to vaccinate? Oh, that's right, 7 billion people. Because what? They want to distribute at least 7 billion doses. Because according to them, to stop the pandemic, even though it never began as of right now, they need to make the vaccine available to almost every person on the plane. Everywhere. So once again, as we've talked about in previous videos, problem, reaction, solution. It's everyone's problem now. It's everyone's issue. Everyone is of concern right now, and it's up to everyone to get involved to stop this, and it's up to everyone to get involved to wear their masks so they can stop the spread of COVID, even though you have to take it off to eat and drink though. Now, again, another thing that's interesting about what Bill Gates says right here is if you scroll all the way back up, it says right here that they're looking to get the COVID vaccine out within 18 months, under 18 months, according to them. Although the fastest was in 5 years. There's many issues with this as well because you don't know the lasting effects of it, especially when they're trying to get it out so fast. And they know darn well that the real pandemic is going to be a result of these vaccines. That soon enough, yeah, people might be feeling all right after they get it, but give it a few months or give it maybe even a few years if it takes that long, soon enough, it's going to have serious detrimental consequences indeed. Now, this is also something I find very striking about this article. What Bill Gates says right here is in these two paragraphs, it's right before this part right here. It's towards the middle of the article. It's about a 10-minute read. Of course, we're not going to go over all of it, but it will be linked in the description box below. However, do not be brainwashed by a lot of the lies that are in here too, because they're going to keep claiming that, oh, it's beneficial and oh, it's going to help people. But this right here says, here's how an RNA vaccine works. Rather than injecting a pathogen's antigen into your body, you instead give the body the genetic code needed to produce that antigen itself. When the antigens appear on the outside of your cells, your immune system attacks them and learns how to defeat future intruders in the process. You essentially turn your body into its own vaccine manufacturing unit. Because RNA vaccines let your body do most of the work, they don't require much material. That makes them much faster to manufacture. There's a catch though. We don't know for sure yet if RNA is a viable platform for vaccines. This is according to them. But they say COVID would be the first one out of the gate. They have to prove both that the platform itself works and that it creates immunity. Yeah, that's what they're going to try to claim when they know darn well it's doing the exact opposite. But see, this part, even Bill Gates says it's like building your computer system in your first piece of software at the same time. Well, let me ask you this. What if the software malfunctions? What if the software breaks down? What if the software goes file shut down? Now what are you supposed to do? I'm telling you right now, folks, there is some DNA altering things in these vaccines, and all of this technology is leading up to a very sinister agenda indeed. And prayerfully, your eyes are open to this, both of them, so that you're able to see exactly what it is that they're doing. Genetic coding. Why do they need to even include that in a vaccine? Could it have something to do with genetically coding and processing with the nanoparticles as well and the luciferase? Changing and altering your body to potentially become a zombie. And who's going to help get out these vaccines? Oh, that's right, the military. Because guess what? In the UK, they're already not only on the streets, but they're already help assisting giving out COVID tests to children in schools too. And here's the footage.
Yeah, giving all tests out.
Guys, we are live at a school.
Giving all tests out to children. This is good. Look at them. Yeah, look at them.
Guys, we are live at a school in Liverpool. Calderstone School. Share this everywhere, guys.
Look at them. Intimidating the kids. Come on, jump out, jump out.
We are live. Calderstone School in Liverpool, I believe. Guys, what are you doing at the school here? What are you doing at the school here today? Please. What are you doing at the school here today? I can't hear you. Can I come round so I can talk to you? Can I can't hear you. No, come round. Yeah. Can you turn the engine off so I can hear you? What are you coming to test the kids in school? Why is the army here to test children? It's dreadful what's going on. Go to the media office. It's disgusting why the army are here testing our children, honestly.
So prayerfully you have a better understanding exactly the bigger agenda and also what's going into these vaccines and the potential detrimental technology indeed. But once again, all of the links will be available to you in the description box below. Now again, folks, now more than ever is the time to seek Yahuwah and his true son Yahusha, because as you can see right now, things are really revving up and it's really getting real out here. And it's important that you have a relationship with your maker, with your creator, by by getting to know his name. This is Truth Unveiled here, saying as always, Shalom.